Hello, everybody. Welcome. Happy Friday. Welcome. And this is noon EST time. I am back with my show, Healthcare Startup Show, for all the innovators who are looking for more opportunities and finding ideas how you can create new startups or you can create an idea around healthcare. I have got a lot of good feedback from my previous shows, except that sometimes my sound comes, sometimes it doesn't come. So I hope today you are able to hear me clearly. Um, Today we are going to talk about a legislation which has recently passed the Senate, actually last week. This is about improving the senior care in Medicare Advantage plans. So I'll give you a story what happens in today's scenario. In last probably 2 years, it has been very complex process to take authorization for some of the services which are even routine or some of the services which requires an intervention in the surgery center or intervention from the specialist. You need to undergo a manual administrative process which is called an authorization from the insurance company to render that complex procedure or a service. Now, it was not there before, like 2, 3 years ago, but suddenly it has started. um, More and more Medicare plans, and not only Medicare plans, insurance companies are mandating that any procedure you need to undergo, you need to take a prior permission from your insurance companies, and especially if you are out of network. But today we are going to just talk about this process which is being happening for seniors. So the House Ways and Means Committee today voted unanimously to advance the Improving Seniors Timely Access to Care Act for 2022. Now, what does that mean? That bill means that the bill would reform prior authorizations under the Medicare Advantage program to help ensure America's seniors get the care they need when they need it. For young patients like myself, we have no problem if we have to we have to go to the surgery center for a spinal care or some complex procedure. It may take a month or 2 months or maybe 15 days before my procedure happens. But for senior people, going through this entire headache of a manual authorization process is a lot of challenge, and more than clinical challenge, it's a non-clinical administrative trauma that somebody has to go through um, by communicating between the doctor's office and the insurance company and sometimes the specialist office, and then coordinating the care. Similarly, people who take care of their seniors, care coordinator, people who are coordinating the care for their seniors, there is always a challenge, especially to deal with the communication part. So with this important reform, which is called, I will come back to that reform. So here is the reform. It's called prior authorization legislation. It has been advanced now in the Senate. What it means is it is going to create the lives of those seniors much smoother because the authorization process would have a standard automated process. And we are going to talk about it, what it entails. Now, with this, I'm going to talk about the Medicare Advantage plan. Somebody has to first understand what is Medicare Advantage plan and why it is important, especially for seniors. So I'm inviting one of my guests today. She is the CEO of Practice Forces, which is a billing company. Her name is Parul Garg. She is on the screen right now, if you can see it. Parul, are you on the call on the screen, please? So, as I was discussing about the seniors, how seniors are going to be impacted or their care is going to be impacted with this single legislation about Can you tell our audience what is, so first of all, what are the Medicare Advantage plans? Why people sign up for Medicare Advantage plans? Fringy benefits which these private companies do provide. So they are private insurance carriers, but they are serving the same senior population with the same benefits a Medicare has. So they have some kind of contract with the Medicare carrier to give them the same benefit plus some added benefits, and that's the reason these seniors they sign up for Medicare Advantage plan. Okay, so that we got it. Now, uh, what is this prior authorization process, and why do Medicare patients have to go through with it? I thought this is for more commercial side, like people like us has to go through it. And then do they need to coordinate with the insurance company as well? So how much time typically it takes between primary care? So if a patient sees a primary care doctor, and suppose primary care doctor sends him to a specialist, and a specialist orders an MRI. Now in this whole process until the patient gets an MRI done, typically what's the average time, and what do we see? Did we see any increase in last few years? How it is happening right now? Is it a manual process? So the staff. So phone, fax, yeah. How do do these staff at the doctor's office coordinate with the seniors? Do they make a phone call to them and then also calling to the insurance company and then collect the paperwork? What's the current process? I understand it because it took me, yeah. So it can take up to a month just to get a normal MRI for a senior or get a shot or something, a complex. Now what about what so how does really work? Who provides the authorization? A physician or an insurance company? So the
Right.
authorization numbers are, so authorization is provided by so
By
the
Advantage plans.
primary care sends the authorization to the insurance company, and then insurance company provides the authorization
Yeah.
to the primary care, and then the primary care sends that authorization to the specialist or an MRI company where
Mhm.
now I see these I mean senior people are really technically very challenged.
Mhm.
Do you see any problem for them adopting technology, or how do they typically, do they show up at the doctor's office? How does it work?
Yeah, most practices are not, they don't require the patient to get these authorizations. So for them, it's easy. And because to Medicare patients, if the service is not authorized, you can't even bill the patient. So they don't actually, for them, they get the service, the provider, whether the provider gets paid or not. So authorization is not a problem for the patient, but the specialist who is getting the doing the test, or the MRI, if they don't get authorized, or the authorization is under a
They
wrong tax
won't get
ID,
paid.
then they won't get paid. That's the problem.
So everybody in this whole chain, primary care, specialist, diagnostic or surgery
Mhm.
center or hospital, anybody, the whole chain has to make sure authorization is on file in order to get reimbursed.
Yes.
So it is a very key information. So thank you very much, Pearl. I'll get back to you if we need more help. Thank you very much.
Thank you.
Hello. So those who missed out some part, let me reiterate one thing. So this particular law is addressing the challenge for seniors for Medicare Advantage plan. Now, why people sign up for Medicare Advantage plan? Medicare Advantage plans are the commercial private payers who have contract with Medicare to provide services or plans on in-network or physicians network to these seniors. And most of these plans, they include prescription drug coverage. Many of these includes dental, vision, and wellness coverage. And also they have a $0 premium and $0 deductible plans sometimes in this area. So due to these benefits, most seniors go for these Medicare plans, and that's why uh, people sign up and they need this authorization process. So what is the authorization process? As Parul described, it's a very complex process, administrative process. So currently, if you see, I took this data from MGMA. The current process for last 2 years have increased for almost at 90% rate. So like in year 2020, we would anybody would need probably the authorization for 10% of the procedure. Now in last 2 years, you need procedures and you need authorization for almost 90% of the procedures. So almost every procedure, every complex procedure which a specialist see or happens at a surgery center or happens at a diagnostic lab, you need an authorization. So this is a very complex process, and you're going to understand what are the deliverables from this law. So this is what the law is enabling it. If it gets passed, there would be an electronic prior authorization program which everybody has to sign up if you are accepting the patients who are seniors and who are into Medicare Advantage plan. Standardization and streamlining the prior authorization process for routinely approved services. So if there is a list of 40-50% of routinely approved services, like um, you need a regular x-ray, you need to have a regular MRI or a shot, you probably don't need an authorization for that. There should not be any authorization for that. So they would provide a list of services, which would basically list of the prior authorization services which does not require an authorization. So there would be a list of items, list of services from Medicare where you don't need an authorization. Another thing, this law would also ensure that all the prior authorization requests are reviewed by a qualified medical personnel, maybe a nurse, registered nurse, or a doctor himself. So it will also increase the transparency around Medicare Advantage prior authorization requirements. So here is an opportunity. With this law, where is the opportunity for startups? And that's the main segment. Most people watch our show, they like our show because they want to smell the opportunity. They want to see where is the opportunity. So here is the whole process: appointment scheduling to enrollment, clinical care, and billing. All of that is performed through the software, and there is a process. But what is more important is now how these new laws are adding more processes into the entire RCM chain. So prior authorization is a huge piece for the continuity of care. So these are the three things which you need to do. Of course, this is for the market. If US is your market, or if you're thinking to create a startup or something, a solution for the US market, these are the things where, if you remember, I talked about the public policy. This is a perfect example of the public policy where we are taking a public policy, a law which is being enacted, and then we are creating a process to address the solution, which is a prior authorization, which is the solution. So we want to automate the entire manual process. And where are the main links? It links to the clearinghouse, which connects with the insurance company. So the first thing is you automate the process at the doctor's level. Second thing is you create a link with the clearinghouse, which links further to the insurance companies. And then you create a communication exchange. That communication hub should address all the component of this particular process, which means patient, insurance company, primary care provider, and a specialist or a facility. So because everybody is a part of this authorization process. So when everybody is a part of this authorization process, you need to create an exchange hub or opportunity or a platform which can address this opportunity. So here is an opportunity. You may find some solutions which is already there, like Athena Health has their own prior authorization, Change Healthcare has something like that. So a lot of these authorization, a lot of these different private vendors are addressing this, but they are addressing it only at a level for the commercial, private young patients for commercial insurances. But now, since it will come for the Medicare Advantage plan, it would be at a CMS level. So you would need more like when people used to talk about electronic billing, and not only that electronic medical billing was mandated by CMS, but initially, and then now across the board, everybody is accepting the same form. So this is what the opportunity for startups. Probably this process is going to be standardized, just like at some point CMS 1500 form was standardized for insurance companies to accept and reimbursement. So similarly, this process is going to be standardized if this law is enacted. So this is a great reform for the and that's where we see an opportunity for the startups. So with this, I would probably take a leave. It's almost 20 minutes I've been talking about. This is a great opportunity for those who really wants to uh, uh, do something in innovation, and who wants to do the uh, with this, I'm going to take a leave. Thank you very much for listening. Please do send me messages. Send me a message even after you listen to this show. I respond to all of my messages, and stay in touch. So thank you very much. Have a happy Friday. Thank you very much.